Medigap plans provide some great benefits if you want an unrestricted network, if your lifestyle includes a lot of travel, or you dread asking your physician for referrals. Stay tuned as I share 5 pros and 5 cons of Medigap plans. After this video, you'll have a lot more clarity on whether a Medigap plan is the right choice for you, and if Medigap plans are worth it. I'm David Luna with Connie Health. Confidently make Medicare decisions with Connie Health's local agents. Our team will guide you through your plan's benefits and the complex Medicare system, leaving you worry-free. Today we are discussing what is a Medigap plan and what do they cover, the different types of Medigap plans available to you, when you can enroll in a Medigap plan, and the 5 pros and the 5 cons of a Medigap plan. Let's start with what is a Medigap plan and what do they cover. Medigap is also known as a Medicare supplement plan and works alongside your original Medicare Part A and B. Medigap plans cover the gaps in original Medicare Part A and B coverage. These gaps include coinsurance, copays, deductibles, excess charges, and other out-of-pocket costs. Also, remember, original Medicare does not have a cap on out-of-pocket costs. So, a Medigap plan could be right for you if you want more reliable healthcare costs. So, what are the different types of Medigap plans available to you? Medigap has several standardized plans for you to choose from in Arizona, Florida, Georgia, Illinois, Indiana, Louisiana, New Mexico, and Texas. Standardized plans make it easier to compare insurance companies. When you're considering, for example, a Plan G, you won't be comparing benefits when choosing a plan. They're all the same. Instead, you'll compare the cost, year-over-year rate increases, and the insurance company's customer service. Let's talk about when you can enroll in a Medigap plan. If you want to enroll in a Medigap plan, it's critical you know your Medigap open enrollment period. Why? Because this open enrollment period only happens once. It begins when you turn 65 and you're enrolled in Medicare Part B. The Medigap open enrollment period only lasts 6 months. Insurance companies must sell you a policy regardless of your medical history or pre-existing conditions during this period. This means that you cannot be denied coverage, nor do you have to pay higher premiums based on your health conditions. If you want to avoid medical underwriting, enroll during your Medigap open enrollment period. Let's talk about the 5 pros of a Medigap plan. I've been helping people make Medicare decisions since 2005. In that time, I've heard a lot of reasons why people love Medigap plans. Here are some of those reasons. First, and probably the most important, except for the select Medigap plans, you can see any provider that accepts Medicare. No matter which insurance company you purchase your plan from, you'll have access to approved Medicare services nationwide. This is ideal if you live a mobile lifestyle, traveling around the United States or abroad. If you generally travel in the United States, you can confidently access medical care covered by Medicare, whether you're in Arizona or Florida. Number 2, Medigap plan benefits are standardized and won't change year over year. Unlike Medicare Advantage plans that can change coverage from one year to the next, Medigap plan benefits are standardized and do not change. Every year, Original Medicare updates its deductibles. And with a Medigap plan, you'll always get the same level of coverage. You'll never need to worry that your level of coverage is going to change. Unlike a Medicare Advantage plan, Medigap plans do not need an annual review because benefits don't change. However, with a Medicare Advantage plan, you'll want to review the plan's benefits every year during the annual enrollment period. Number 3, with a Medigap plan, you do not need to choose a primary care physician. With a Medigap plan, you'll never need to request a referral to see another doctor. This provides care flexibility. You can see any doctor or specialist you'd like that accepts Medicare and is accepting new patients. You only need to pick up the phone and make an appointment. With a Medigap plan, you'll still get coverage from your original Medicare. The benefit here is that you will likely not have to deal with any claims paperwork. Original Medicare will receive the medical claim from your doctor or specialist and then pay its share. Then the bill will be forwarded to your Medigap company for them to pay their share. This is great because you usually don't need to be hands-on during the claims process. Instead, it's handled seamlessly by the insurance companies. If you ever get a bill in the mail from a provider and are unsure what to do, You can call a local Connie Health agent to help. As your advocate, we support you throughout your Medicare journey, including straightening out confusing billing issues that sometimes arise. Your Medigap plan covers some or all of your out-of-pocket expenses. Remember, these costs include coinsurance, copays, deductibles, excess charges, and other out-of-pocket costs. If you choose a plan that covers some of these costs, the cost sharing will be predictable. Medigap plans help you have reliable healthcare costs. With Medigap, estimating how much you might pay for a particular medical service is easy. For example, Medicare Part B covers 80% of your outpatient benefits after you meet the deductible. Popular plans like Medigap Plan G cover the other 20%. With Plan G, you wouldn't pay out of pocket for Medicare-approved services. Now that can provide you with peace of mind. The same is true for a Part A hospital stay. You won't be faced with surprise medical bills. Finally, pro number 5, Medigap plans automatically renew. Are you worried about losing your Medigap plan due to a change in health? A Medigap plan has a guaranteed renewal. This means your coverage will continue as long as you pay your premiums. For this reason, enrolling in a Medigap plan is often a good choice for someone with pre-existing medical conditions or who has a lot of medical usage when enrolling in Medicare. People I work with have told me Medigap provides them peace of mind because these plans automatically renew. So now let's talk about the 5 cons of the Medigap plan. So, what do people usually not like about Medigap plans? And why might someone choose a Medicare Advantage plan instead of a Medigap plan, also known as a Medicare Supplement plan? We just listed 5 reasons why a Medigap plan is a good option. But with that comes a cost. Overall, Medigap plan premiums can be more expensive because of the 5 pros we just mentioned. Number 1, no network. Number 2, standardized plans that do not require a review. Number 3, no choosing a primary care physician or needing referrals. Number 4, predictable out-of-pocket costs per hospital and medical care. And number 5, a plan that automatically renews. The average monthly Medigap plan premium can range from $100 to $400 or more. You will pay the Medicare Part B premium, plus, depending on your chosen plan, you may pay Medigap plan premiums, deductibles, copays, or coinsurance. Number 2, Medicare supplement plans, also known as Medigap, don't include all the extra benefits that many Medicare Advantage plans offer, such as dental, vision, hearing coverage, and more. You can't get routine dental or vision exams, prescription eyeglasses or contacts, or hearing aids unless they're medically necessary. With the Medicare supplement plan, you could pay thousands a year for comprehensive dental, vision, and hearing coverage. Con number 3, you'll need to buy Medicare Part D prescription drug coverage separately. This means that you'll be paying at least 3 monthly premiums, Part B, Part D, and Medicare Supplement, and maybe Part A. Medicare requires that you have credible prescription drug coverage through Medicare Part D or another source. Medicare Supplement plans work with Original Medicare Part A and B, but don't offer any Medicare Part D coverage. A Medicare Advantage prescription drug plan could be more cost-effective if you have no or low medication utilization. With this option, you're provided one card for both doctors and pharmacy. Now, con number 4. Original Medicare experiences deductible and premium increases because of inflation. Your plan's rate increase will take place annually on your Medigap policy's anniversary date. But beware, an additional rate increase will occur the month after your birthday. If you experience a rate increase, you can shop other insurance companies to see if the same plan is offered for less. A local Connie Health agent can help you shop your plan options should a rate increase impact your budget. Remember, the good thing about Medigap plans is that they are standardized in states such as Arizona, Florida, Georgia, Illinois, Indiana, Louisiana, New Mexico, and Texas. In these states, you can shop around for the same benefits, but at a lower price, with consistent rate increases or better customer service. Finally, con number 5. If you want to change Medigap plans for a better rate or another reason, you may have to undergo medical underwriting. For this reason, not everyone can change their Medigap plan once enrolled during their Medigap open enrollment period. Medical underwriting reviews your pre-existing health conditions and prescription drug history. Then, the insurance company will decide whether to offer you a policy and at what cost, or may deny a change in your Medigap coverage. Some chronic health conditions may make it hard or even impossible to change to another Medigap plan. Because changing your Medigap plan later can be difficult or impossible, choosing the right plan up front is critical. When the time comes, a Connie Health agent can help you choose a plan tailored to your health and budget needs. Finally, except for select Medigap plans, most offer an unrestricted nationwide network, no referrals, and protection against surprise medical bills. For these reasons, a Medigap plan may be a good option for you. Be sure to weigh the cons before making a decision. If you're still weighing your options between Medigap and Medicare Advantage plans, a local licensed Connie Health agent can help. Call the phone number in the description below, and a Connie Health agent will help you make this critical decision. Connie Health is here to help you throughout your Medicare journey. If you like this video, please click on the subscribe button now.